This is my client Natalie, who flew from Illinois?
Mm-hmm.
Yeah, to see me. And we treated a left AC joint, but her primary reason for seeing me was sacroiliac joint pain in the region of her left PSIS. And she's a runner, and she's going to tell her story.
Okay, so I've been running for a long time, and suddenly in October something started hurting and I couldn't run anymore, and I would try to run and it hurt bad enough that I had to stop after a few steps. So I went to several chiropractors who worked a lot on trying to figure out some things. I tried acupuncture several times, and the pain was just not going away, and it was just an annoying pain that was always there, not allowing me to do any really sort of impact exercising or any sitting, which was affecting my teaching because I couldn't sit on the floor with kindergarten, first, second grade kids, and I feel better when I exercise, and when I couldn't exercise, I wasn't feeling very great. So I went to a doctor, had several MRIs, kind of did a little wild goose chase. They were checking whether things were wrong with my kidneys, and there was nothing wrong with my kidneys. Tried physical therapy for 6 weeks, couple massages, and nothing was alleviating this nagging, annoying pain that's just kind of been there. And so my brother mentioned that he came out to see Jerry in November. Actually, he mentioned it to me in November. He came out several years ago, and he fixed his foot, and he told me to come out and check it out. So after a little bit of delay and procrastination, I decided I was just going to do it because there was nothing else that was working. And so on my first day, some things were feeling okay. I came back the second day, and there was one just annoying pain that was still bothering me on my left side, and we did 2 things and then it was gone. And then I went for a run. I went for a 3-mile run yesterday and a 2-mile run this morning, and I feel great.
So one interesting thing about your pattern is that on the first day you presented with what I call a posterior ilium, and that's a twisting pattern in the pelvis. And so then after we corrected that and restored movement, then it converted to what's called a right in flare, left out flare pattern, and we found that L5 had a tendency to rotate left, so we treated your L5S1 facet also. Mm-hmm. And so then you came back and you still had some soreness right over the region of the PSIS, although you were better. But then we found a different type of flare, what I call a type 2 or traditional type of left out flare. And then we corrected that, and that seemed to make a big difference for you. Mm-hmm. And so it's interesting how the pelvis kind of, it's like peeling an onion. You know, right. It has layers that you will not see initially.
Yeah.
So it's a process, not, you know, if I had just treated what I saw on day 1 as this kind of the traditional model, where you get a diagnosis on day 1 and then all your treatment is based on that,
yeah.
We would have failed you. So it's kind of like waltzing, you know? There's a step change. There's something that's not predicted, you know. And then the clavicle was compressed, and we decompressed that. And probably the last thing I want to ask is, do you feel competent in self-managing this condition?
Yeah, I do. After just double checking and checking over to make sure the roller was in the right place. Yeah, and the exercises and stretches feel good. So
nice.
I'm really confident that
great.
I can do those.
Yeah, so we have you doing about 8 things for your sacroiliac and low back,
yeah,
and pelvis. And then we just talked some general strengthening for the shoulder girdle, and we taught your husband
right.
via film
right.
how to gap that joint on a weekly basis.
Yep.
So I would predict that shoulder will be fine, you know, within 3 to 6 weeks, and same thing for the low back.
Great.
So thank you for sharing. I really appreciate it, and thanks for making the trek.
Yep. Thank you.
And you came in on cold weather, and you're leaving in warm weather, and
yeah.
This is the Denver area.
Well, we'll see what it's like back in Illinois. I'm sure it's still cold there.
Yes, indeed. Well, thank you.